Hey everyone, and welcome to This Explainer. Today we are taking on a genuinely massive, absolutely vital topic. We're going to completely decode and, frankly, destigmatize the complex world of sexual health. We're talking about sexually transmitted infections, or STIs. There is just so much misinformation out there and, honestly, so much unnecessary fear. So we're going to break down the science together, see exactly how these infections manage to outsmart the human body, and most importantly, empower ourselves with the actual facts. Let's get right into it.
Listen to this. You can have an STI without knowing it. I really want you to let that sink in because it completely disrupts the most common assumption we all tend to have about sexual health. We usually think that an infection is going to, announce itself with these obvious, visible signs, a rash, a sore, something you can definitively point to. But the reality? An infection can be transmitted even when there are absolutely no visible signs whatsoever. None. This creates a really fascinating and dangerous knowledge gap, and it's the exact mystery we're going to solve today.
Okay, let's dive into this. Here is our structural roadmap. We've broken this huge topic down into 5 logical buckets. Number 1, the invisible epidemic. Number 2, curable bacteria and parasites. 3, manageable viral infections. 4, beyond the genitals. And finally, number 5, prevention and testing. Starting with part 1, the invisible epidemic, unseen and unfelt. The absolute core takeaway from our research here is the very real danger of asymptomatic transmission. These infections often spread quietly, causing incredibly mild symptoms or, in a lot of cases, literally none at all. Which is exactly why waiting around to feel sick is just a totally flawed strategy. That brings us to part 2, curable bacteria and parasites, treatment and elimination. What unites the pathogens in this next group is pretty amazing. With the right medicine, they can be completely evicted from your body. Chlamydia and gonorrhea. These are 2 absolute heavy hitters in the bacterial world. The major and, well, somewhat terrifying theme here is that both frequently show 0 noticeable symptoms, but leaving them untreated, hugely dangerous. Untreated chlamydia, for instance, can contribute to pelvic inflammatory disease, which can cause permanent damage to the reproductive organs. Now, both of these are completely curable with antibiotics. But getting treated doesn't give you some sort of permanent force field. You can easily be reinfected. And with gonorrhea, the medical community is facing a really growing concern right now: antibiotic resistance. The strains are actually adapting, which makes proper testing and targeted treatment more critical than it's ever been. And this brilliantly illustrates the deceptive progression of another really complex bacterial STI, syphilis. It usually kicks off with just a single painless sore. But then, without any treatment at all, that sore just vanishes. The person thinks they're totally fine, but actually, the danger has literally just begun. It moves into a second phase, producing systemic symptoms. Think rashes, fever, or swollen lymph nodes. Eventually, it hits a latent stage, just hiding quietly in the body while potentially causing severe, irreversible damage to your brain, heart, and nervous system. Because its early symptoms pull a literal disappearing act, catching it early through testing is absolutely crucial. All right, to give you the full picture, here is a rapid-fire look at the sheer variety of other STIs and skin conditions. We've got trichomoniasis, a super common parasite that, just like our bacterial examples, often has 0 symptoms but is easily curable. Then there are microscopic mites causing pubic lice and scabies. These spread through close skin-to-skin contact and cause intense itching. We also see less common bacterial STIs like chancroid and LGV, known for painful ulcers, or donovanosis and M. genitalium. And finally, conditions like molluscum and mpox, which cause skin bumps and spread through close physical contact. These often just resolve naturally or with targeted management. The key takeaway? There's a massive variety out there, but practically all the bacterial and parasitic ones on this list can be effectively eliminated. Let's move on and see how this builds, because understanding these curable infections highlights a fundamental biological divide. Bacterial and parasitic STIs can generally be cured, right? Evicted by antibiotics or targeted meds. But viruses, they operate entirely differently. They are manageable and often lifelong, but as you'll see, they are highly controllable thanks to modern medicine. Which brings us to part 3, manageable viral infections, control and care. Now, I want to approach this category with a whole lot of empathy because this is exactly where a ton of the fear and stigma lives. Hearing that an infection is lifelong can sound terrifying, but not curable absolutely does not mean untreatable.
Take genital herpes and HPV, for example. Herpes, mostly caused by the herpes simplex virus, is permanent, but a lot of people have symptoms so incredibly mild they don't even realize they carry it. For folks who do get outbreaks, antiviral meds can significantly shorten them, reduce the symptoms, and lower the risk of passing it to a partner. Then you have HPV, the human papillomavirus. It is just overwhelmingly widespread. While some types can cause warts or cellular changes that lead to cancer, the incredibly empowering fact here is that most HPV infections are naturally cleared completely by our own immune systems. And even better, unlike a lot of other viruses, we actually have a highly effective preventative vaccine for the most dangerous cancer-causing strains of HPV, a real game changer.
Now, what's really interesting here is how modern medicine has completely rewritten the narrative around HIV, with this striking medical equation, U equals U. Undetectable equals untransmittable. With highly effective antiretroviral therapy, the virus can be suppressed to such incredibly low levels in the blood that standard tests can't even detect it. And the science on this is absolutely definitive. When a person living with HIV maintains that undetectable viral load, they literally cannot sexually transmit the virus to a partner. It is a phenomenal victory of medical science, turning what was once a deeply feared virus into a manageable chronic condition.
We see really similar medical victories when comparing hepatitis B and hepatitis C, two sexually transmitted viruses that go after the liver. For Hep B, we've got a highly effective vaccine to prevent it right out of the gate. For Hep C, there's no vaccine, but modern antiviral medicines have advanced so far that they can actually cure it in most people. That is a super rare instance where a viral STI can be completely eliminated from the body.
Moving right along to part 4, beyond the genitals, the whole body. Because these are labeled sexually transmitted, people naturally assume they are strictly confined to the reproductive organs. But honestly, that is only half the story.
Depending on the specific type of sexual exposure, infections like gonorrhea, chlamydia, syphilis, and HPV can easily set up shop in the throat, the mouth, or the rectum. So if you only get a standard genital urine test, you might completely miss an active infection sitting right there in your throat. Testing absolutely must be based on where the exposure actually occurred. On top of that, we have to talk about congenital transmission. STIs like syphilis, HIV, and hepatitis B can actually pass from a pregnant person to their baby during pregnancy or childbirth, which can cause some really severe complications. This just totally emphasizes the vital importance of comprehensive prenatal screening to protect newborns.
Finally, part 5, prevention and testing, taking control. We're shifting gears now, moving away from the clinical facts and diving into actionable, stigma-free health strategies. This is where you take back control.
So I'm posing this question directly to you. How can STIs actually be prevented? I really want to frame prevention not as something to stress over, but as an incredible tool of knowledge. When you know exactly how these pathogens operate, you can easily outsmart them.
So here is your actionable toolkit. First up, using condoms and other barrier methods correctly drastically reduces the transmission of a lot of STIs. Second, get vaccinated. The vaccines for HPV and Hep B offer unbelievable proactive protection. Third, we have cutting-edge HIV prevention tools like PrEP, which is a daily pill you take before an exposure to prevent HIV, and PEP, which is for after a potential exposure. And lastly, because we know this invisible epidemic thrives on asymptomatic infections, scheduling regular STI testing is literally your best line of defense. Again, you simply cannot wait to feel sick to go get tested.
As we wrap up this explainer, I really want to leave you with this destigmatizing thought. Sexually transmitted infections aren't a measure of someone's worth, character, or morality. They're just infections. We absolutely need to disarm the shame surrounding this topic. STIs are caused by microscopic bacteria, viruses, and parasites. They happen to people of all backgrounds. It is entirely a matter of biology, not morality. Understanding them, treating them, and preventing them, it's just a normal, healthy part of regular healthcare.
So, the crucial point is this: knowing your status is always better than guessing. Don't just guess based on assumptions, or because you happen to feel totally fine today. Use the incredible medical tools we have available to take absolute charge of your health. So, I'll leave you with this final thought. Knowing that the greatest threat is the one you can't see or feel, what step will you take today to rewrite your own sexual health narrative? Thanks so much for joining me for this explainer.